Welcome. My name is Don Frush, and I am a pediatric radiologist and a member of the steering committee for the Alliance for Radiation Safety in Pediatric Imaging. Over the next 15 to 20 minutes, I hope to review with you a little bit about the Image Gently campaigns and specifically touch on the strategy for the Image Gently campaigns, which is based in social marketing. The Alliance is comprised of 4 societies, including the Society for Pediatric Radiology, the American Association of Physicists in Medicine, American College of Radiology, and the American Society of Radiologic Technologists. Now, Image Gently is the name of the campaigns. The Alliance is the organization through which the Image Gently campaigns were created and dispersed. The Image Gently campaigns are a communication campaign really dealing with advocacy. How can we do things better in imaging children and potentially young adults? As you can see, CT was the first campaign, but there have been several others since then, which I will review briefly. It's important to know that this alliance comprises more than 800,000 participants and includes 70 organizations, of which more than a third are international. So the basis of the campaigns is what is called social marketing. Social marketing deals with an idea, a concept, which is intended to alter social attitudes. But importantly, the benefit to this alteration is not really to the market itself, but not the marketers. And the fundamental and unifying element for the Image Gently campaigns is the appropriate imaging for children. Now, social awareness, this communication has been done primarily through several different avenues. And it's important to realize here that the social aspect of social marketing touches on so many different communities, physicians, other medical specialists, scientific experts, the public, regulatory agencies, etc. And through these various avenues, as you see here, websites, summits, speakers at national meetings, etc., is really how this communication is embodied. The Alliance is comprised, as I said, of more than 70 organizations with a steering committee, as you see here. It's important to realize that these organizations and the membership in this steering committee really touches on all stakeholders, radiologists, other imagers, medical physicists, radiologic technologists, and other content experts. It's important to have this broad consensus support in terms of developing and releasing these types of campaigns. So I will review briefly some of the general efforts, the campaigns themselves, some of the meetings, and what the international affiliations have been. This is the website, and simply it's www.imagegently.org, and this was a newly built website just a few months ago, and I would recommend that you look at this. Much of what I'm discussing today is going to be on this website. These are the campaigns. There was a CT campaign released first. We've had fluoroscopic campaigns, interventional radiology campaigns, CR, nuclear medicine, and again, I will discuss each of these briefly. So let's first talk about the interventional radiology campaign overview, and Manrita Sidhu was instrumental in developing this here. And again, if you go to the website, www.imagegently.org, you will see recommendations for performing pediatric fluoroscopy that maximizes study quality as well as dose control. There's information for imagers, for radiologists. There's frequently asked questions and answers to those questions, and there is information for general healthcare providers as well as parents and public, again, on the Image Gently website. Another campaign, the Pause and Pulse Fluoroscopy campaign, that was supervised by Marta Hernan Schulman. This was titled Pause and Pulse. Again, the same types of information on there, information for healthcare professionals, information for experts in imaging such as radiologists, information for the public as well as patients. And all of this content is on the website there. Again, there are answers to some of the frequently asked questions that come from, again, this society, this broad community of those invested and involved in pediatric imaging. Nuclear Medicine Work Group, a campaign that was spearheaded by Dr. Ted Trevis here, really began in 2008 with a survey of nuclear medicine programs. And what was found, and what has been found with many of these campaigns, is in fact pediatric imaging radiation exposures, radiation dose or dose estimates have varied substantially. And this was the similar finding with nuclear medicine, where this survey found a factor of 3 to 20 in terms of variability for identical examinations in the pediatric population. There was subsequently a consensus work group that formed, and from that work group resulted a poster, and this information is available on the website, that gives ranges of typical study doses for radionuclide imaging for pediatric population. CRDR, computed radiography or digital radiography, this campaign, a recent campaign that was led by Dr. Stephen Don, again dealt with a survey of individual practices, sometimes children's hospitals, sometimes those practices based in adult environments, and ask about various techniques for imaging children using radiography. The chart here is fairly detailed, but if you just focus on the upper portion of this, on the right-hand side of the screen here, you'll see a substantial variation in terms of the techniques used at younger ages here for various imaging modalities. As we have found with CT imaging, as has been evident through nuclear medicine surveys, what has been practiced in the general community has really been a fairly wide variation. And going back to the fundamental structure of the Image Gently campaign is trying to improve, trying to fine-tune imaging protocols and recommendations so that the appropriate amount of radiation is used in infants and children. Here is a checklist that technologists can use in terms of performing examinations that can be available on site. Dental radiography or dental imaging, something that we don't think of in the radiology field as much, just because it is really outside of our area of expertise. But when you think about it, imaging from a dental standpoint, dental radiographs, potentially cone beam CT, is something that almost everybody is exposed to during childhood. And through the cooperative efforts of colleagues and expertise in the fields of dentistry, information, not a specific campaign, but information is available on the website that deals with dental imaging doses, as you can see here, and comparisons of those doses, and talks about issues and strategies related to the performance of these examinations, and again, how we can perform these examinations better in infants and children. I want to move on to an effort that was partly directed by Keith Strauss, in addition to several other medical physicists, that really was designed to try to improve our ability to estimate the types of doses delivered by computed tomography. The phantoms available and the methods for estimating doses from those two phantoms simply didn't apply, especially to the younger population. And those dose estimates could vary by factors of 2, 3, and 4 versus what the doses actually were, being potentially substantially higher. So the American Association of Physicists in Medicine, Task Group 204, proceeded to have this report, which is now colloquially referred to as the SSDE report, or size-specific dose estimate. And basically, the concept is easy here. We needed some sort of modifiers to be able to take what is available on the scanners, the CTDI estimate of dose, and make it more applicable to a broader range of sizes. So we have a fairly complicated slide here, but what this shows is, with information about the cross-sectional area or dimensions of a child, whether it's AP or medial lateral or a combination of both. From these data, you can go to a lookup table. You can take the CTDI, which is displayed on the scanner, and you simply multiply that by a factor that is relative to that child's size. In this case, that factor is 1.08, so the 9.29 milligray is multiplied by 1.08, giving a more appropriate dose estimation for this size child, in this case 10 milligray. Moving on from the various campaigns and scientific efforts are other avenues, as I discussed, in terms of getting information out, the social marketing. And these have included vendor summits. The next CT ALARA summit is going to be in February of 2014. There have been CR and DR summits and a prior vendor CT summit from several years ago. In addition, its presence and presentation at various professional societies and other meetings that may be involved in regulatory aspects of CT, including those that are sponsored by the Food and Drug Administration. So these are some of the national efforts, and I would say that when this campaign started, when the alliance was formed, there was a thought that perhaps this kind of project would be applicable to the global audience. What happened was quickly, very quickly, and fairly obviously, there was a need beyond the United States, and so these international affiliations became quite an important part of what the alliance was about. These affiliations deal with a number of organizations, which include the World Health Organization, the IAEA, etc., as listed here. And those organizations have been extremely important partners in terms of making the material available to their populations, their audiences, and the individuals that they are responsible to. Kimberly Applegate has been really instrumental in moving the international efforts for the Image Gently campaign forward. We are continuing to recruit new alliance members. There are a number of translations approaching or even exceeding 20 at this point in time on the website through the IAEA, the Radiation Protection for Population Fluoroscopic website content review is there, and again there are ongoing collaborations as I have discussed before. The World Federation of Pediatric Imaging, or WFPI, is another important affiliation that is intended to strengthen the ability to get information on appropriate pediatric imaging to all parts of the globe. So now we've talked a little bit about social marketing. We've talked about some of the efforts that have been done. We've talked about the fact that it is becoming increasingly recognized as an important effort throughout the world, but has it made a difference? And so one way that we can assess this is to survey a population. And this is what was done and will be illustrated in the following slides. Before I get to that, though, it's important to realize what the success has really been based on. And it's not simply that the word Image Gently is something that people can align with. It's not simply that imaging is important and people believe that we should do it the best as possible. Those are all elements, but the success of the alliance has really come down to organization, message, and delivery. The organization has to be reputable. It has to be independent of commercial bias. It has to involve all stakeholders, as I said, physicists, technologists, imagers, including radiologists. The message has to be important. It has to be simple. It has to resonate with those populations. And the delivery is really important here. You need media expertise. It must be controlled content with a speakers bureau and so on, so that the alliance and the Image Gently message can be controlled and relayed in a consistent fashion across populations. The importance of the campaign has come up in a number of different areas. This Joint Commission report from just over a year ago specifically mentioned the Image Gently campaign as a method for which departments' imaging practices should subscribe to in order to assure that their imaging is within a reasonable practice. So going back to, is the Image Gently campaign successful? What is the impact? If we just look at social marketing again and awareness, we want to make sure that, how do we assess whether people are aware of this? Image Gently has certainly recognized. A recent Google search revealed 6,600,000 results. But what is the impact? Well, what we elected to do was survey leaders leaders of radiology practices that were not based in children's hospitals, and this was across the country. We had 186 responses, which was 15.7% of the ACR practice leader group. And we actually found that 98% of these children were not based in a children's hospital. This was the group we wanted to target, but that the vast majority did image children. The vast majority had heard of the campaign, and the majority had actually altered their practices, including CT practices, including fluoroscopy practices. And I put this chart on here just to simply illustrate that the responses consisted of about 58 to 72% said they were actually lowering their doses depending on the type of CT that was performed. So what are the goals? What do we hope to accomplish? We as a community imaging children hope to accomplish over the next 5 years. This is a recent article that was just published at the end of last year that I think outlines these things that the campaigns target and what the Alliance continues to hope to do to improve imaging for children across the world. So if impact equals recognition, then the Image Gently campaign as a strategy, using a strategy through social marketing, has been globally successful at improving radiation protection for children. Thank you very much.